Good afternoon and welcome to this monthly webinar of IHE-Europe. Before we start, let's go over some practical things. Please keep yourself muted during the session. There will be ample time to address your questions at the end. We will have Q&A at the end, and then you will be able to speak up. Before we give the floor to our guest speaker of today, we would like to point out the activities that will be happening at the Connectathon Week at the end of June in the beautiful Allianz Stadium in Vienna. So as you can see, there are plenty of interesting activities. There will be Connectathon testing for 5 days. On top of that, there will also be an Austrian projectathon, an ALGA one, where IT systems connect or test their interoperability. There will also be interesting plugathon educational tracks during 4 days. These will be on topics like IHE-Share, EHDS, I2X, and My Health at My Hands. Please watch out our website because registration and all details on all the plugathon tracks will be available as from next week. There will also be the IHE-Europe Experience Days, but we will cover them a little bit later. Thank you for being with us, and please note that the recording will be made available on our IHE-Europe YouTube channel, where we have also our other monthly webinars available for you. I will give now the floor to Eva, IHE-Europe interoperability expert.
Good afternoon, everyone. Welcome to today's IHE-Europe webinar. Today's session is part of our regular webinar series, and it will be focused on Austria's national roadmap towards the European health data space, with a focus on primary use of health data. This timing is very relevant, as Caroline already mentioned, regarding the IHE Connectathon Week in Vienna. And part of this Connectathon Week event is also IHE-Europe's Experience Days on the 24th and 25th of June. And one of the highlights at the Experience Days will be a session on national roadmaps towards the European health data space, where Austria will be represented alongside Norway, Germany, and Slovenia. The EHDS regulation sets a common goals and obligations for the member states, but the starting point and maturity levels are very different. And that's why it's very important to exchange different experiences between countries. So it's a pleasure to welcome Helene Brenner as our speaker today. Helene has been working for the past 6 years at ELGA, the Austrian National Digital Health Agency, and currently leads the Department for International Projects, and is involved in several European initiatives and cross-border collaborations. Helene, thank you for being with us today, and the floor is yours.
Thank you so much, Eva. It's great being here. I'm very honored to be talking about how Austria is facing the EHDS and how we can build this roadmap. I'm personally really super excited to the future that's ahead of us. And I want to start off with this AI-created picture of the future in Europe. There is this one thing that I always tell my colleagues once I'm talking about the EHDS. So in Austria, being the center of Europe in terms of our location, it's very much often that we just hop to other countries. And usually we take our passport, but we actually don't really need it at the borders. And that's all due to the European framework we're living in. Actually, it's pinned down here, Schengen, and that's something that we in our personal lives are very much used to. We have a lot of European jobs, so we are, as European citizens, very interconnected. And many of us probably have also consumed healthcare somewhere across Europe, and that's not been in our home countries. But the only thing that's always missing is taking the data to this 21st century level as well, and taking the data with us as well. So I really love the vision of this joint European Union healthcare system that we are basically, at least in terms of data, that we are building. To start off, I'm going to have some introductory slides about the EHDS to also cover those who haven't really been reading the full EHDS regulation up until now, to then delve into how we in Austria are reacting on it and where we're at in our planning. All right, let's get started with the problem definition of the EHDS. That's actually been taken from the official communication papers of the EHDS way back when the EHDS regulation has only been proposed. And then if you look into what's there, let's start with this red bubble up here, because that's basically all of us. It's us as being a European citizen, no matter where we live. And I guess a lot of people here as well today in this call have faced that in their personal lives as well. We have difficulties accessing and controlling our own health data. Whenever we are somewhere consuming healthcare in our systems, it's not all the time that we actually have the control of our data, even though it's ours. So that's a big problem, and that's something the EHDS is tackling. Let's go to the next level here. It's the health professionals. Also, they have difficulties in accessing health data. And also the digital providers, they have a hard time scaling in Europe because we have such a scattered system. And then at the very bottom, something that's very dear to my heart as well, it's the research layer. We're very much used that our data is stored in silos, not only in Austria, I'm very sure in all the European countries. But as data is the one big thing that's growing more than everything else. And we really need to get going with good decisions and good policy making. That's going to be the groundwork for the future of our healthcare system. So also that is a huge problem. A lot of policymakers up until now cannot really easily access health data. And also the research we're doing for the future of our healthcare system takes place on the basis of health data, but also they face huge barriers in accessing those health data. So that's what the EHDS is also focusing on. It's basically those 3 pillars that we're gonna talk about as well. And it's also our roadmap in Austria that's basing it on those 3 layers. So let's go into the blue layer. It's that we as patients have access and control. Doctors and healthcare providers access primary data whenever and wherever needed. That's the primary use of data part. I marked it with a blue box. You can already see there might be a structure that you're going to see again somewhere else in this presentation. Then this green box, it's all about market barriers, EHR systems, lowering market barriers for digital healthcare providers. In some sense, yeah, it's a paradox way of looking at things. If you look into how the European health data space is actually lowering market barriers. It's by putting more regulation, but by that also being able to scale market barriers a bit easier, market solutions easier. And then we have the red box, and that's the research box. So everything about using data for secondary use. All right, so if you look into the future that the EHDS is going to create, in this very middle part, we have the space, the data space, where all health data, no matter if it's from my health tracker watch, my Apple Watch, an Oura Ring, or any other source, or it's from EHR systems, or it's from national electronic health databases, all those data, all of them together, build the data space, and it's about accessing them in the right moment, in the right structures. And that's how we empower citizens to have control over their own data, because they finally get the access. We enable healthcare professionals to have access to the relevant data, because in the one moment they need to take the best decisions, they have the data available. That's the future goal. And then we have the research side, where policymakers, innovators, finally have access to health data. In the end, to have better healthcare policy and greater opportunities for research and innovation as Europe as a whole. So that's basically the EHDS and also the pillars on what the EHDS is being built. What you can see here as well on this slide in a very short way, for those who are not that familiar with how the EHDS has been established, it's basically part of the European data strategy that was put out in 2020. And 2020 marks a very relevant year for all of us. You're very familiar of those two. I'm not sure if I can call them friends, but we know them very well. So I'm talking about COVID. And when COVID hit Europe, we were very much focused on healthcare. And that was also one of the main policy steps, this focus to make the European health data space the first data space to be regulated from all the data spaces that are planned within the European data strategy. So in May 2022, the EHDS regulation was proposed, and just now in March, 26th of March, the EHDS regulation actually entered into force, and from now on, the time is ticking, because now we are asked to actually fulfill the regulation. So let's delve into the impact the EHDS is creating, and the EHDS is also coming up with new brands within our work. You can see those brands here. We are talking about primary use and secondary use, but what the European Union does is they give that a brand. So My Health EU is the brand for primary use, and Health Data EU is the brand for secondary use. And that's exactly where we're going to delve into. And what I love about this slide is still the general one, how the EHDS is being built. It's that there is different means on how to look at this regulation part. And of course, there's the legal base, but there is a lot of new governance aspects to it. So with that, there's also new bodies that are going to be built in Europe, like the EHDS board on the European level, but also nationally, we are allowed or we're asked to build new authorities. I pinned them down here. So the Digital Health Authority, Market Surveillance Authority, and the Health Data Access Body. That's the three organizations that we really need to build as well. So let's collect some more of the background information to then pin down on how we build our roadmap. So what I really love about the EHDS is that we're building on existing cooperation. So we are not just starting this very huge endeavor on ground zero. No, we're starting somewhere much further. So what I'm talking about is the back in the days called EHDSI infrastructure. So what we already have, you see the countries in dark blue that already exchange data throughout Europe. And that's an infrastructure existing, as most of you probably know. And there is a lot of countries now joining in, but it's been on the voluntary basis up until now. We know that. And the EHDS now will make this data flow across Europe mandatory for everybody. So let's look at the scope. We have the EU projects to date. When Austria, I put down the Austrian map here, is exchanging data with other countries. We're at the moment in starting those services. We actually just went through the test sessions very in a very nice manner. So we passed all the tests, and we're now actually on the technical level already able to exchange e-prescriptions and e-dispensations and also receive patient summaries. A project that I'm personally also allowed to lead, so that's great. But the EHDS is gonna make that mandatory, as I said before, but it goes much further, as the whole system that we have been built in Austria with ELGA is tackled as well. There's completely new requirements for ELGA and the whole e-health in Austria. There is requirements that are coming up for software manufacturers in Austria, as also in the whole European Union. there's completely new rights for patients also on the portals that need to be implemented in Austria. And we finally, and that's something very new for Austria, have the possibility of secondary data use in Austria with the health data. For you, to give you a bit of a background information, when ELGA has been established in Austria by law, it was decided that we're not allowed to use ELGA data at all for secondary use for research purposes. So up until now, that has been in our law. With the EHDS, that's gonna change. So also for Austria, there is a lot of movement going on, whereas on the ELGA side of things, so for primary use, we already cover a lot. So we at some points need to adapt a bit. Some points we need to fully establish because we haven't done that yet. But most of the part we have established, and we're building on an existing infrastructure that's working, that's live, that is used each and every day by our healthcare professionals and patients in Austria. So that's something very good, but also it's a chance for us to basically re-innovate ELGA as it is with what the EHDS is bringing. So how is Austria now reacting to this huge regulation that I'm personally very excited about? So let's start into primary data use. You know that the EHDS has only been entered into force in March. So if you look into budgeting in Austria and starting projects, as probably all the other countries have that as well, that is decided a year ago. So what we try to do is prepare as much as possible for the expected outcome that the EHDS is actually going to be decided on and also published and enters into force. So what we did is start a project that's called Fit for European Health Data Space. And that's an ELGA project, so where we in ELGA look into all the requirements that the EHDS is basically asking ELGA to change. So we have a huge requirements analysis going on right now, and at the very moment we're in the means of developing this roadmap. So I try to give you as much input, even though we're not finished with the roadmap yet, on how we approach the EHDS and on which basically categories we need to switch things around as well. So that's the big project that's at the core of that. But not only that, as you know, and you have seen, Austria up until now has only been this light blue country. So we are not live with any cross-border health service yet, even though we just passed all the tests. So it's gonna come soon when you have the law as well. So what we did instead is looking at those things that we have never done before, and that's basically establishing the cross-border e-health projects. And we have the last two, the 3 and the 4, as both 2 projects that we established in order to come up with cross-border services. The first one is EHDSI, it's called, and the other one is Austria MyHealth.eu New Services. In the first one, we built e-prescription e-dispensation in use case A and B, and in Austria MyHealth.eu New Services, we come up with lab results. What's the first service that's going to be based on FHIR for us? Up until now in Austria, we are still exchanging data on CDA level. So that's exciting. We have some innovation going on in this project, but we also gonna get hospital discharge letters and patient summaries from the EU, so the use case B, that we're going to implement as well. And the patient summaries is something that we as in Austria already are able to do on a technical level right now. Now the next focus point this year is lab results to then also come up with those services. So just to give you a grasp of where we in Austria are at. And then very importantly, I really want to mention this very important project. We are, of course, part of Extended EHR. What's the joint action to build or to basically discuss the European exchange formats and that are going to come up, and EHR requirements. Very, very important project where we have this big stakeholder consultation this year, when we are very actively involving the whole scene in Austria from all manufacturers, EHR system providers, healthcare providers to really give the feedback, to make them part of EHDS and make them part of this conversation on the future of our healthcare system in a digital way. And then last but not least, what today I'm not talking about too much on is secondary use of data. There's another organization in Austria that's called Gesundheit Österreich GmbH. That's a public health agency. And they also have a co-finance project. They are basically starting the secondary use infrastructure and building this project right now. So also there, we are basically preparing us since more than a year to already delve into the EHDS. Okay, now let's look into what we found out. So, we have the EHDS regulation, and what is the important thing to mention here is the second layer here. It's the implementing act. Most of you will probably be familiar with the term of implementing acts. With the implementing acts, the European e-health exchange formats that I talked about prior in the extended EHR project will basically put down the actual data formats that we're going to use for all the services that are going to come up. And those implementing acts will be expected to be decided on in March 2027. So from then on, we really knew how to basically implement it on a very technical level. Up until then, we're preparing each other for all the work that's going to come and trying to put as much input from our experience in Austria into the extended EHR project, into this public consultation for the European e-health exchange formats. So now looking into Austria, we have the cross-border setting and we have our national setting to look at. And there is basically 3 pillars that we organized our requirements analysis around. The first one, I'm going to start from the right, are the MyHealth services. I'm not sure if you're all aware of the services that are going to come, but they're mapped out here. So what's going to come up is patient summaries, it's e-prescriptions and e-dispensations, it's medical images and image reports, it's the results of medical examinations like laboratory results, and it's all the discharge reports. So there's a lot of services. Some of them, and I'm going to delve into that, Austria has already been establishing, some of them not. So there is some new data categories to be implemented. Plus, there is a mandatory format for those EHR systems coming up as well. In Austria, those services up until now have already had a mandatory format, but the one from Austria. So there will be quite some changes in adapting our existing standard to the exchange formats that are going to come up. That's the first pillar. And the second pillar is centered around patients and patients' rights. So what's very interesting to look at is how in Austria, we are identifying an patient. And we have a huge system for that around the so-called e-card system to make all the patients be identified within the EHR systems. What's interesting now is that when a patient is entering the portal, they need to use the European Union identification, so the EID, we call that in Austria. That's something that's actually been done already. So once a patient enters the portal of ELGA, they use the electronic ID of Austria already. So that's something we have done quite well. So there's not too much to change. But what is going to change is the access part and substitute part, so the proxies, because proxies up until now are only the ones that are put down by law. And the EHDS is discussing that it must be able to in a very user-friendly way nominate substitutes or proxies. That's something that can't be done on the ELGA portal up until now. So that's something that we are digging into and preparing for. And then last but not least, something that we're not sure how this is going to look like up until now. up until we know the European e-health exchange formats and more from the implementing acts, is that the EHDS is also telling us that patients can contribute data themselves. And that's something we're not doing in Austria at all. So something we're building on, but we're still lacking the very concrete requirements to map out a project around it. And then last but not least, we have the healthcare providers' rights and obligations. So we have two main things that's gonna cause a bit of change in Austria. Up until now, our healthcare providers, of course, are identified with like a two-factor authentication system, and especially the outpatient area, they will not change too many like differences. But what the European health data space is telling us up until now is that it might ask for an EID authentication system as well. What's a bit tricky if you look into the hospital setting of things, because up until now, our hospitals within ELGA, what is solely operating on networks, they are authenticated and by an organization level. So what we need to change around is the whole accessing to the ELGA system. So each and every, let's say, healthcare provider working in a hospital, no matter if it's a nurse, no matter if it's a doctor or any other healthcare profession, they will need to log in somehow with their electronic ID. That's something they don't do up until now, the EID, so EHDS ready. So there will be a whole project around that for Austria to become compliant, even though there's still some information missing from implementing acts. So also here we have still a bit of room there. All right, now let's delve into what I like the most, the actual services, because they're gonna make the difference for the patients. And on the very top, you find patient summaries. And also up until when we're gonna become compliant with the patient summaries. That's something that's very new for Austria. You can already see that all the other services are basically in some way already existing in Austria. The one thing that's missing and we have never implemented is the patient summary. So that's new. That's gonna bring some innovation here. And we're starting projects, or we already started a project to come up with the Austrian patient summary, and right now in conceptualizing how patient summaries are gonna be set up in Austria. So that's new. If you go into e-prescription and e-dispensation, it also needs to be there in 4 years, mandatorily by the EHDS. And here we have really good news in Austria. That's already existing. So we're very prepared for that. The one thing we're gonna change is updating the format according to the European exchange format and integrating the cross-border part into the EHR systems as well. That's not done yet because it's not live. So that's something that's gonna come up. With images, Austria has also been delving into image and image reports world. Image reports are there for a very long time, but the actual images are existing already, but not in all the counties yet. We have them in Lower Austria, in Vienna and in Styria. It works brilliantly, really well. It's one of the most exciting projects in Austria. It's existing, but of course, also here, we might need to update the format a bit, and we have the cross-border use case to be implemented. The medical test results, it's already existing. It's already there. All the hospitals give the medical test results by now. What we're still missing is the outpatient clinics to also contribute to the system. So there is a rollout running at the moment. So we're going to be quite good off there. We have 6 years time. So we're going to update the format once we know it. That's going to be in 2 years and then be compliant very quickly. The nice thing about the medical test results and lab results is that we are also implementing that right now on the EHDS I level, so the cross-border use cases. It's the first FHIR standard. So there's a lot being done around that in my project at the moment already. So we're quite ahead compared to the timeline the EHDS is basically asking us for. And discharge reports, last but not least, is something that has been implemented in Austria for a very long time as well. It was actually the first service that was going live within the ELGA system. So that's something that's also existing. But also here, we need to, of course, update the format. And also, it looks like it's becoming a FHIR standard. So a lot needs to be done around changing our system from a CDA-based system to a FHIR-based system. So that's on the roadmap. And then let's delve into the green pillar that we had prior. So which requirements apply to manufacturers of EHR systems. So there's basically two main components that the EHDS is asking all EHR systems to implement. It's the interoperability component around the European exchange formats and the logging component. And both of them need to be fully implemented no matter to which system. So I mapped out here a little infographic for that with the hospital information systems and the doctor's information systems, all kind of apps that basically have any kind of data that is stored, held for the treatment of patients that are dealing with those priority categories we went through. So there's a lot to be done on this level in terms of communication to the EHR systems, to the manufacturers, to build this whole realm because they need to change. And there is this new conformity process that's going to be built. Plus, there is the Market Surveillance Authority that needs to be established as well. And the very important part here is that the EHDS is asking us to have this national test environment being built as well. Part of that is being done in ELGA already, but there needs to be, of course, a lot of adaptation. And by that, that is one of the main focuses to also build it to become ready for the EHDS. Last but not least, and just very quickly delve into secondary use. It's, as you know, not the specialty of ELGA as we deal with primary use, as Eva mentioned in the very beginning already. But of course, as the big community of EHR manufacturers, they're also the ones holding data, and they're also the ones that are going to be asked to share the data for the secondary use. So that's also something we look into, so that all the data then will also be used for the secondary use, and that the market is prepared. So that's the next pillar of our roadmap. Well, let's look into the EHDS and MyO30 the current status and outlook. Something that I didn't mention fully were the timelines down here with the cross-border services that we are already in. So what we know for sure is that law is going to come up to also take the e-prescription, e-dispensation to the cross-border level. The only thing that's missing is basically the law. Then we can start with the production environment tests, and we expect that to be latest by 2026, depending on our law and when it will be passed. Simultaneously, even though we started with this project very much later, the patient summary, the use case B, will already be implemented at the same time with the e-prescription e-dispensation now. And the lab results will be the next one at the end of 2026. And then in the beginning of 2027, we're going to have the hospital discharge letters in use case B. So that's something as an outlook. And as I already told prior, and you could see from the presentation as well, there's two main milestones also in the basically for all over Europe. It's the obligation of when e-prescription e-dispensation and patient summary will be mandatory. That's in 4 years, so in March, the 26th of March 2029. And same for images, discharge reports, and lab results. Also, they will be mandatory, but then 2 years later, in the 26th of March, 2031. Also put down the links for those who haven't really read the EHDS regulation yet. There's also a great link for the frequently asked questions that were put together from all the questions that came up throughout the last years. Something I can can really recommend you to read through. All right, now let's look into the timelines to make it a bit more graspable. In the very beginning, we started off with the blue box, the green box, and the red box. You find it here as well. Let me just add the yellow line, the general application. You can see here on this red dotted line, this is when the EHDS entered into force. And now there's basically 2 years for the deadline of implementing acts that are going to come up. In the meantime, of course, our national laws will be adapted and the first authorities will be named and built. And that's something that's going to happen here in the first 2 years. Then in primary use, I already mentioned that in the last slide, those services are going to come up. What we're doing now is focusing on patient summary so that we have the national patient summary basically up and ready to make it then cross-border able as well. That is going to be the next step for that. And we already started with the project, plus take the newly established format from the implementing act at the very moment we get it, adapt the last bit of it, and then try to come up with this service and do the whole rollout nationally in these years. With e-prescription e-dispensation, we only gonna adapt the formats, so that will be a fairly easy task. With the medical images here, we also gonna wait until we have the implementing act. We don't expect too much change though. The main thing we need to focus on is the cross-border part. And lab results, we're also gonna change the format around and discharge reports as well. Now here with the EHR systems, this is where the testing environment will be built. For everybody who's not been aware of the timelines, new EHR systems will only be allowed to be sold from that are having like patient summary in the prescription dispensation data in with this first group of categories. So you, as an EHR manufacturer, you're only allowed to sell compliant products from this date on. So there will be a lot of communication work, capacity building in Austria around that. And then we have the second wave in 6 years, so by 2031 for the other categories. Well, and then we have secondary use. They have basically the same timelines. We're going to also establish the health data access body, plus the whole infrastructure around it, plus make all systems being interlinked with that. That's going to be a huge challenge for us and is on our timeline. There's another way of looking at things. You can see here that with 2027, also the EHDS board and stakeholder forum will be established. Around this time, we're going to have a designated digital health authority, and the testing environment I already mentioned will be there in the beginning of 2027. And then we have a designated health data access body that's also needs to be there from 2027 on. And that being said, I hope I could give you a good overview of how we're approaching the EHDS in Austria, where we are at, giving you an overview about the EHDS and what's going to change in Austria. I thank you very much for the attention up until now. I'm looking forward to your questions, and I wish you a safe journey into a digital health future.
Thank you, Helene. Thank you for your passionate presentation, and also very interesting. Also, congratulations to Austria. You're on a good track, I think. And I think that some of the countries would like to look how you, how you've come so far. especially when I talked for Belgium, the discharge letter. I would love to see how you are evolving. And I do think that some of the countries, we should work closer together through institutions like IHE-Europe, because in the end, we will have to use the same format, right? And for infrastructure and other matters, we can definitely learn from each other. So now I address myself to the audience. Please get yourself prepared for some questions. You can raise your hand. We do have a question in the chat, Helene. Does Austria use the IPS for patient summaries? Because you said that your patient summary will be ready as well, or is already ready, because it's one of the first things that you did, right? So can you elaborate a little bit on this technically?
Yes, I can.
Are you using the IPS?
So, up until now, yes, we use the IPS, but mind you, again, the patient summary is the one service that we haven't established in Austria up until now. So we currently just started the project around patient summaries to have it implemented nationally as well. At the moment, we base it on the IPS, very well knowing that there is slight differences to the European patient summary. So we're waiting for the exchange formats to arrive in 2 years, but we're building the project already on the base of the IPS to set up everything else that is basically needed. So that being said, unfortunately, we don't have it yet in Austria, but what we have is the technical solution to have a patient summary as the use case B in Austria. So receiving patient summaries from countries that already have patient summaries if a patient is coming to Austria in one of our healthcare institutions. And by that being said, that's the standard that is being released by the EHF network. So it's the European one. Okay, that was the first question.
Then there is a more general question. It's not related to Austria, but will there be financial support from EU, the member states, to support healthcare providers in adapting to the new needs and regulations? So, Mr. Schwartz, you are relating to the healthcare providers. From what I understood, Europe will not provide any funding, right? They will be make some testing environment available, and from the member states, that will depend from member states to member states. Maybe you can add something to this, Helene.
Yeah, thank you, Jenna, for asking. So up until now, there is no official financial support, as Colleen mentioned. However, there is constant talks if specific projects, if needed, can be supported also financially by the European Union. Up until now, as far as I know, there has not been any agreement on it. But I know that it's also being discussed constantly, also with like the different funding schemes that are out there to enable all of us in Europe, all the member states, to actually implement the EHDS in a timely manner. But up until now, as you mentioned, Colleen, there's no official funding scheme for that.
Well, thank you, Helene. We are open to other questions. So, or maybe you're all overwhelmed of the achievements of Austria. Andreas?
Yeah, thanks, Helena, for this great presentation. It seems Austria is extremely well on its way already. I adopted many other member states are that far. But to my questions, I'm from Siemens Healthineers. Regarding the data formats or the more structured data, the Inspire is of course about generating more structure in the data and not having only narratives or even PDFs. But I suppose that many healthcare providers are not really in a state to provide, for example, lab results in a more structured format. What's your take on this? How this will develop, or what challenges might there be to getting in the full structured
in the full structured format? Yeah. actually, you mentioned the one standard or the one service, but I feel like we have the highest level of structured data. Lab results are highly structured most of the time. It is going to be a huge transformation, and that's going to be true for all the countries with the FHIR standard. But even though FHIR is on a technical level structuring those data categories differently, you still have the possibility to have basically those free text issues as well as you have it in the CDAs. So even though changing the format, it will be it will be compliant with the data formats, I'm sure. And also, what's the nice thing about it? Also, the terminologies will be standardized throughout Europe, so that's good. But there will still be some room for those not 100% machine readable data fields. So that FHIR won't change that around.
Mm-hmm.
Has that been your question?
Yeah, absolutely.
Yeah.
Thanks. But if I may have an additional follow-up question on a slightly different topic. You showed that the EHR systems have to implement this interoperability component, which is, of course, not only about the format in the end, but it means essentially an API to be able to receive and send out data in that format. Do you expect some impact on this on the ELGA infrastructure? At the moment,
Yes.
Of course, there's an XDS-based infrastructure in Austria. These will now be FHIR APIs in the end. Mostly, I think, intended to be for exchanging data inside a healthcare provider. But there needs to be some connection to the existing ELGA infrastructure. What's the thinking on that?
Well, that's a very good question. It's not been resolved yet in Austria. It's currently being discussed as the whole roadmap is being discussed. So you now just saw the inputs to come up with the roadmap, right? That should be done by the mid of this year. So the base of ELGA and everything that we built on that we're also very proud about won't be changed if not needed. So that will be my realistic spin on it, even though I must say, of course, it's not fully decided yet. A lot of things depend on the implementing acts that are going to come up. We see that at the extended EHR project at the moment very much. There is this one deliverable around EHR requirements that's been highly discussed by all the member states. Some of you who are in the project that I see in this call as well, that's a very interesting discussion going on right now. Depending on the actual requirements, our infrastructure is going to adapt to that as well. So for FHIR, as you said, there will be, of course, new things coming and being added to this infrastructure as well, like the APIs, etc. That's something that we need in any case if we build the FHIR structure. In which detailed form that's going to happen is still in discussion. Yeah.
Thanks, Helene.
You're welcome.
We have a hand from Vladimir, sorry.
Yes, thanks a lot. I would like to know which steps are planned or expected at least in order to keep the small practices, the thousands of doctors across the country to be fully adopted in the loop, because without them the European health data space will not work, definitely. So how to motivate them? What technical steps, organizational steps are expected?
If you're talking about the small providers, are you talking about the healthcare providers or talking about the EHR manufacturers? Just
it's
to make
about
sure.
The healthcare providers.
Healthcare providers.
I'm employee of CompuGroup Medical of the Czech organization. We have the colleagues also in Austria, but you are our neighborhood and same size of country and probably the same problems on a market.
Yeah, on a market level. So healthcare providers, also small ones that have been next to ELGA up until now, will, even though there's new formats and of course the EHR manufacturers need to adapt, they won't really feel the difference too much in terms of their adaptability, just that at one sudden they have much more data available, and hopefully also the systems are, you know, developing in a nice direction as well. But that's basically being solved already on the Austrian scale. If we only talk about those healthcare providers that have been connected to ELGA already, but, and now comes the but, the EHDS is talking about more types of healthcare providers than we have been connecting with ELGA up until now. They are not specifically naming the professions, but that's on the member states to define which professions are part of their health professions. In Austria, there's a law for that. So we already know basically the roles, and not all of those roles have access to ELGA up until now. So your question for me applies very much to those who haven't even been connected. And there will be two groups that I feel like are going to come. There's the ones that are basically just adapting, and those who are very afraid to adapt. It's still not finally discussed, but there's more solutions to that, especially if you're talking about, let's say, a physiotherapist who not necessarily has this huge information system like a doctor's office would have it. So what we are thinking about is building a portal around that as well, to make them get the access very easily without any costs to adapt. So that's one idea on that forefront, but there is many more ideas around, and it's a brilliant question, because that's something we're gonna see. It's the important part is to really take everybody with us on this huge journey of implementing the EHDS. So it's a lot about capacity building. It's also a lot about digital health literacy, but it's also about the resources of the systems they connect with in terms of their data and the ones they're going to read from their patients. Yeah, so that's the ideas to this question at the moment.
Thanks a lot.
We have a question in the chat. How is quality of data enforced within EHDS? Is there a certification process required for application delivering data to EHDS?
Thomas, that's a great question if you're asking. I'm not sure if you're also asking the secondary use of data part. I'll try to answer it for the primary use of data. So there is this testing environment that needs to be built, and everybody needs to comply with the data formats. And also there is quite some data quality level enforced within the FHIR standard that I'm sure you're quite well aware of. And that's also going to be checked within this testing environment. So this is how the quality of data will be enforced with the EHDS, even though I must add that as we don't know the exchange formats yet, there might be room for a very strict data quality insurance scheme or a rather broad, easygoing one, as all the member states need to comply with those standards. There's always a high tendency that with discussing and actually making such a standard mandatory for all the member states to, you know, go on a bit of a lighter scale in terms of enforced data quality, so that each and all the countries actually can fulfill the task as well. But that's something we're only going to see in the future, or basically in the next 2 years. It's at the moment discussed in extended EHR, and for you, as I know you're from Austria, you can also give your input to those standards through this project. So I can send you the link after the session for the Austrian consensus panels if you're not signed up yet.
Thanks a lot, Helene.
You're welcome.
I think, yeah, quality of data is indeed a huge challenge that we all face, right, at so many levels. So it will, yeah, the efforts will have to be done at all of these levels as well, at a continuous level, and maybe technology can help out healthcare practitioners there as well.
Yeah,
Hopefully also in a structured way, right?
exactly.
Eva, you have a question? You have your
Yeah,
hand
thank you.
raised.
Yeah, Helena, thank you. First of all, thank you for your insightful presentation. I would like to ask you, how do you see, or where do you see the role of citizens in the transitions toward the EHDS? And I would be interested in if Austria has a strategy how to support the engagement and increase the awareness of the citizens.
That's a very good question. We're currently discussing that as well. So for me, the driving force of not only the law itself, but also the potential driving force of the future of this whole European health data space regulation is the patient. Because it's really putting the patient in the center, in the middle, and gives us as patients power to really get our data. And that being said, I think it's that driver on all kind of levels, on the governance level in terms of how the law has even been established, but then also if I'm a consumer and the power of consumers is a very big one. I go to a healthcare provider who is not compliant. I'm not going to be happy. So that's the market will feel that. And so what we plan in Austria at the moment, and that's something we continuously do. So also in ELGA, we have an established system around that to inform patients, to, get the messages across. We're going to use our channels that we have built up until now. Not specifically only on EHDS, because a lot of it will be done via the ELGA system, as far as all our stakeholders have planned it up until now. So we're going to use existing channels to get the messages across. Plus, there is a whole project being shaped at the moment around capacity building. And this capacity building is going into the healthcare providers' direction, but also to the patient's direction. That is a project that's being set up in the ministry. And yeah, so there might also they might come up with a quite nice new way of communicating and engaging with patients as well. In terms of how the EHDS, in terms of technical solutions, is basically making it mandatory to have this portal. We already have one. We're at the moment having a project as well where we are redesigning this project. So we're taking the requirements coming up from the EHDS with this whole project. And whenever we design software, probably everybody does, we also involve the users. And that's also the third pillar of how, with our, let's say, modern software engineering in Austria, that's being done as well. So that's the channels, more or less. And then there's a huge stakeholder engagement and communication process being done in any way. Yeah. I hope that answered, give you some insights.
Very active also in this field. Thank you. Thank you so much.
Exciting times. I also think EHDS is a very exciting because it will give so much value to everyone, but it will be challenging, that's for sure. And I'm also trying in my role for the industry. I'm pushing them towards interoperability, right? Because that's the key of it all. Thank you so much, Helene. And we hope to meet you in Vienna in June. And I hope it was an interesting webinar for all of you. We hope to see you next month and at least in Vienna. Thank you so much.
Hope to see you in Vienna. All the best.
Thank you very much. Bye.